You know, when Meredith goes to the hotel in Salt Lake City and she's really upset 'cause she doesn't get a bath?
Yeah.
I'd be upset too.
I did think, you know, I was like, interesting.
Maybe.
Because I would be upset.
Yeah, what if you have a bad pain day and you need a bath?
I need to mermaid ASAP.
Yeah, like if I had a bath in my room and you didn't, I would give you my room. I would just ask that if I did have a bad pain day that you'd let me have a bath.
Exactly.
But I would feel like your need might be greater than mine right now, for sure.
I don't know. Who knows what pain days are.
Yeah, how do we quantify things?
exactly.
Numbers are tricky. Hey, I'm Hypermobile, and if you're listening to this, I'm guessing you might be too. Hi, my name is Alex, and I'm your Hypermobile host, and today we have on Hannah again. Hannah, thank you for being here.
No problem.
Welcome back. How was your sleep last night?
Oh, about half as good as the night before, but weirdly, I tried to listen to podcasts in the morning and then I got really engaged and I was just like, I gave up.
Did you listen to Help? I'm Hypermobile.
I listened to...
There's only one right answer here, and the door is there.
May have not. No, that would have been too intellectually stimulating. That's my answer.
Oh, some compliments. You know, it's really interesting because that brings us into kind of like the podcast as a whole, because the first 2 seasons, if we call it that, the first, you know, episodes that exist right now, they're me kind of just info dumping. Like I pick a topic like pregnancy or intimacy or I don't know, fitness and stuff, and I just like will sit in front of the camera. Setup was all my own, really stressful, and just like be like, here's everything I think you need to know.
Because you did it in your own flat, didn't you?
Yes.
Yeah.
It was low budget.
Was it cat disasters all the time though?
So I had to do it when they were sleeping. So for listeners who might not know, I live in a tiny apartment in London and I have 2 very athletic and very large cats. Cleo talks using buttons, so it was a concern that she would be pressing the buttons.
Yep.
Her first word was laser for anyone who cares about my cat children, quite frankly. But yeah, she luckily kept quiet when I was recording for the most part. But there may have been some food involved with that. But going back to the podcast, thank you for the compliment about it being intellectually stimulating.
It's true. And it wasn't an excuse at all.
It's all right. I won't judge you. But the first 2 seasons were really very like fact based. Now for this season, I've kind of done something a little bit different. I wanted to bring some different voices on here. I wanted to talk about some of the conversations that I get to have with wonderful people such as yourself. And I wanted to do it in a way that's like conversational and just kind of easy to listen to, because life is hard.
Yeah.
And sometimes we just need it. Chill vibes. We'll put some studies in the descriptions if you want factual stuff. There are resources that you can check out if you want specific numbers and references. But what I really wanted to focus on is like the real experience of all of this. And you very kindly interviewed me for the first episode of this season. So it's all been filmed out of order. But the first episode of this season, you interviewed me. And I talked a lot about kind of my personal experience. And then after that episode, I interviewed my coach right now, who I'm doing some kind of personal training exercises with, and some gymnastics stuff. And I just felt so anxious last night.
Yeah.
I went home and I was just like, I know that I'm not a typical person or I know that I'm someone who is not currently having the typical experience right now in this moment of living with hEDS. And I'm diagnosed with that now. I have that official label. I didn't have it for a while, but now I do. And I just felt this awareness or this pressure or this fear, I guess, of being judged for talking about what works for me. And I try and be clear and be like, you know, this might not work for you. Or actually, I think I say very clearly a lot of the time.
Yeah,
I'm
you
like,
do say it a lot.
Yeah, I'm like, your body is your body. My body is my body, you know. And it all comes down to kind of risk benefit decisions for every individual. And I do some things that will be higher risk for some people, some things that have some risk for me, but I make those decisions on how to really minimize, address, or at least consent to the risks of activities that I do.
Understand fully what what experiment you're going to sign up to a little bit.
Yeah. And the reality of all this too is like sometimes things that are like weird or frowned upon help. So we have you on today to talk about you, and we will get to that in a second. But it's kind of like a segue into that, because I know we've both had kind of atypical experiences in some ways. I found, for example, going back to kind of my gymnastics lessons, which again sound much more glamorous than they are.
So exciting.
It's really not. I am not Simone Biles. I am like lying on the floor trying my best to feel things in my body.
Yeah.
But sometimes I do hang off bars, and I got into kind of hanging movements, even though my shoulders are hypermobile.
Yeah.
I've never had a dislocation. I've never had profound instability in the joint. Yes, they sublux.
Yeah.
I thought that everyone's shoulders would like clunk into place each night to say like, I thought they were my body saying goodnight to me. Like, do you get any subluxations when you're falling asleep?
See, this is the thing. I wouldn't. I sometimes you're not sure whether you are subluxing. I'm not entirely sure. But I certainly remember when I was younger, which has stopped now, thankfully, was lying down in bed when you first lie down, and my lower spine was in agony.
How old were you?
I would say it probably started like early teens.
Yeah.
And then it stopped probably about 24-ish.
Ooh.
I don't know why. I have no idea why.
Knock on wood. Like,
Let's hope it happens. Yeah.
Yes.
Stays that way.
Yes.
But it was like my spine was settling, and I think it was obviously stretching out in a certain way.
It'll decompress. That's why we're taller when we wake up in the morning, and it was decompressing.
I know. Some people
One
are.
day you'll be tall.
I know. If I lie down enough, maybe I'll get
Are
tall.
you still getting growing pains?
Do I still
I'm joking.
I
growing
stopped
pains.
growing at 12.
I was going to say, maybe you will go taller now. I've ranted about growing pains so many times on this podcast. I'm not going to get into it again today. But going back to kind of the fitness stuff, so I found with my shoulders, I was struggling to do like, people say do body weight movements, do planks.
Yeah.
Planks would give me agony. Even TheraBand exercises, like external rotation ones, I would struggle with them. But hanging off a bar felt comfortable. And for me, sometimes doing things in an atypical way is what served me well. So for building this upper body strength by focusing on doing pull-ups, and being thoughtful. So again, my wonderful coach, he talks about how we're working on beat swings and kipping. And I know there's a lot of criticism of like people who swing off bars in certain ways, but when you're very technical about it and you're focusing on those minute details, like we review videos of me to make sure that I'm getting the exact shape right and tension.
It's like an athlete would.
100%. I like to role play as an athlete. That's how I kind of live my life. But I feel like it's important to talk about because it's what works for me.
Yeah.
But I'm so aware that what works for me is not going to work for you right now.
Exactly.
For example.
Yeah. There's things that I would do that wouldn't work for you at all.
100%.
I mean, I can just about do washing up, standing up.
Yeah.
And you're like, no.
Oh, no.
No.
Oh, the standing.
I hate it, but I can maintain it a little bit.
Yeah.
But did you think that the hanging would be okay for you? Did you have an idea going in, or was it more, I'll give it a bash and see how I do, but carefully?
Yeah, for me early on, it goes back to that work I did with athletes initially, kind of learning about movement, which again, I think everyone in my field needs to have a really deep exercise base. Because when you're trying to help people who are hypermobile, and we know that building muscle and exercising safely is one of the best things, if it's possible and safe. And if it's not possible or not safe for you, don't do it.
Yeah.
But if it's possible and safe for you, it's one of the single best things you could do. So for me, going through my journey of my career and just my own personal journey, I learned that you can kind of think of exercise, especially strength building, in terms of pushing and pulling with different joints and in different directions. So you can push with your upper body or you can pull, right? Just to break down movements in a really simple way. And I was trying to do planks and push-ups. So I was really trying to do push-ups at the time, or press-ups as they call them in the UK. And I would have so much pain, even doing push-up. I'm like, which pronunciation
what
do
they
I
call
do?
it in the US?
Push-ups, they call it in Canada and America.
What do we call it here?
Press-ups. Anyways, whatever you want to call them. I was trying to do these movements from my knees, and I was getting so much pain in my shoulders. So I then said, and this is why we talked last on the intro episode, we'll release these two together as a nice little listening
24 hours previously.
Listening experience. Yeah, 24 hours previously. It was like less than that. But I realized I couldn't do pressing movements well and they were hurting me. So I said, okay, what if I do pulling movements? I noticed very quickly I didn't have the grip strength to hang off a bar properly. So I started doing ring rows. So for listeners who might not know, a ring row refers to hanging rings off a rig. Again, my wonderful coach, he's saying rig. And I'm like, people might not know what a rig is.
No,
do you know what a rig is?
Is it a bar?
A frame.
Because I only know that because of school gym.
Okay.
Of which I was very strong but very clumsy.
Yeah.
Bad times.
I'm excited to talk about you in a sec because you're as atypical as I am, to be honest. But I would hang off a bar and I could feel it felt nice because it was giving me kind of space in the joint. I think people talk so often about having kind of too much movement.
I initially would think, too much space, bad times, like some blokes dislocate.
Yeah.
But you're kind of, there's an intermediate part where you're like, oh, that's relieving.
Yeah. People with low back pain often find hanging off a bar helpful, or, going in a swimming pool, or different ways to kind of decompress.
Or the bath.
The bath, exactly.
The bath's a huge one for me.
Yeah, I love the bath.
And for the bath, like, I'm sorry, electronics, but they have a short life with me, because I will go in the bath. I will mermaid in the bath. I will have my computer, not on your cheap one though.
Yeah, are you being safe? Because we don't want electronics in the bath.
Can I tell you my setup?
Yes, you can.
Okay, so Safety Alex can put a hard hat on and listen, right? So this is what I do. The poodle sometimes demands to lie on the floor next to me because he's a Velcro dog and he doesn't like being on his own. So he will sometimes wander in and out, but it helps the humidity as well because I leave the door open because I live on my own. So that's how I say it to myself, right? So then I purposely got a laundry basket with a flat lid. It's very important.
Okay.
And I put a towel underneath the computer or the iPad or whatever.
Okay.
And then I set my thing up. The bath is already done. I put a towel over the keyboard so the no steam or water goes in there.
Okay.
I set Real Housewives usually. And I put my little flamingo LED light on, so I don't have the lights. This is usually a pre-bed sort of situation, and so it's like lit up with the purple glow.
Yeah.
And then I put Housewives on and lie on my side because I can lie on my side without any pain. And I just
your comfy positions. That's like,
that's what I do. I just mermaid.
It's about having your safe, like you have your own little safe space and your little setup. And when you're having a bad day, like, where to go.
Yeah.
You just like crawl there and you're like, I'm going in the bath.
I've set up, I haven't realised, but I've set up systems, processes and symptoms.
Didn't set those up. They just kind of happen.
They just happen. But yeah, so that's my setup. So you can take inspiration from that.
I love that.
As you like, but the cats would probably mess with that.
Do you bring 3 beverages? I shut the cats out. The cats are not allowed in. I bring tea, electrolyte beverage, and water.
Now, this is where I know my limitations. Because if I have drinks in the bath, they will get dropped.
How?
Have you seen my hands?
That's true. I have like large sticks.
I'm too strong for my hands. No, I'm joking.
Yeah, we're going to do some grip strength
No,
testing.
but my proprioception of my hands is shocking.
Yeah, you have dropped a few things.
I mean, the Japanese food yesterday.
I didn't probably introduce you to, like, you're my dear friend. You're someone I've met through social media. You're someone who, again, just to introduce you properly, you are what I would call a patient expert. You're someone who's gone through a lot, and you're not a qualified healthcare expert or professional, or you're not a medical doctor. Just like
in no fashion.
Yeah, neither of us.
C in science. Yeah, B in science.
But B's get.
No, but I'm saying that's as far as it goes.
Okay, but that's okay. But this is not medical advice, so I can't remember if I did the medical disclaimer, but if I didn't do it, I don't think I did it. If I didn't do it, this is not medical advice in any way, shape, or form. Please speak with your healthcare provider, ideally your medical doctor, and we might swear or say things that are not appropriate for younger listeners. So
the mood might take us.
Who knows what's going to happen? But going back, you were talking about like your strong grip strength and so on. So as I was going through my fitness journey, I kind of started to realize, in my case, the importance of grip strength. I was in my, I was going through the dark times, kind of at the start of my osteopathy degree. And I was like, I want to build grip strength. It feels good when I pull my body weight against things. I think because it gave me a way to feel tension, if that makes sense. I know it's weird. And most importantly, pressing was painful. So I was like, if I can't press, I'm going to pull.
It's interesting.
And it was literally just, I can't do this. Can I do this?
And it just felt nice. You just went on vibes.
I honestly am such a vibes person. So I will prescribe exercises for patients, and I tell them, I'm like, firstly, of course, if you have any pain, of course, let me know this or that. But I tell them, I'm like, if you don't like the exercise for any reason, if you just don't like it because you just don't like it, you don't have to give me an explanation. There's like a million different ways to move your body and exercise. It's my job to support you in that. Tell me. I will not judge you. I'm one of those people, you've seen me be like this. I'm like, I just don't like this. And I know. Why.
The vibes are off.
Sometimes you get a bad feeling and you just know.
And just to interrupt really quickly, because I want to just say when, I can't remember what we're talking, again, I apologise to people listening. I joked with Alex that my hoodie should say, wait, I forgot what I was saying, because that will be me. But there was something earlier that we were talking about, finding different ways to kind of engage the muscles and to, you know, I think the shoulder, you were saying pulling and pushing in just different ways.
Yeah.
I didn't realise, this is, again, how little I think about like, muscles and stuff, which is ideal that you're my friend now because I can, you can teach me. At your workshop, you were talking about, oh, well, if the patient doesn't like this movement in this way, we can just do this way. And I was just like, what?
Yeah.
I didn't realise you could achieve the same outcome with certain muscles or whatnot in so many different ways, because my experience of physio was always, no, there's this one and this is how you do this muscle. I just thought there's only one way to engage a muscle. Like, that blew my mind.
I think there's two reasons why that happens. And again, like I tend to treat the whole manual therapy, rehabilitative exercise professionals, if you call that, physiotherapists, osteopaths, and chiropractors. And yes, I know they are different qualifications, and there are people who are very, you know, firmly like, oh, like you have to see a physiotherapist, or you have to see an osteopath or whatever. And some have different certifications or different areas of specialization than others. For example, I do not do immediate post-surgical rehabilitation. That needs to be a physiotherapist who's trained in that way. Or if you need respiratory physiotherapy, again, I'm not your person. I'm not trained in that. So there are certain specialties that have different, I don't know, perks or different benefits in different ways. But if we look at this profession as a whole, because people will have muscle and joint pain and they'll kind of just see someone in this field, in this type of field. And what I will say is that people encounter the experience you had for a couple of reasons of kind of being told, this is how you do this. One, it's the healthcare provider, the musculoskeletal expert. It worked for them, and they're projecting their experience onto the patient, and their brain cannot cope with the fact that something that worked for them might not work for something else.
They've had, I would imagine, had a patient who was a real, like, made them feel really good about their turnaround. Like, no, this method works.
Yeah, you can have bias from your experience. There's so many types of bias you can have. It could also just be that their knowledge base isn't that deep. Maybe they aren't particularly well versed in exercises for this joint or this thing we're trying to address. You know, maybe their depth of exercise knowledge is not that great. I really think that the best people in this field are people who generally are going to have some personal experience with exercise, because my goal is to get people out of the treatment room and ideally working with, you know, coaches or personal trainers, or getting into that fitness setting, maybe even managing themselves in a exercise-based process. Yeah, 100%. Like they're
fly by themselves.
Look, being in an appointment with me, maybe it's like fun, but it's more fun to not be in an appointment with me. Like I enjoy leaving the clinic room, and I want that for my patients as well. So I think sometimes they potentially, they just they don't quite have that base of knowledge that helps to bridge the gap between what the patient needs to do in the real world to manage it and what they can do for the patient. I think we've reached that like limiting point sometimes. Does that make sense?
Once it leaves the clinical setting, it kind of falls apart a little bit for some people.
Because the patient isn't supported in knowing how to progress it or how to modify it. Or, you know, they might not know, like you, oh, if this hurts, I can do it this way or something. They might not have that expertise. And I think as well, there's a bias sometimes from looking at things from a strict evidence base. So there are some exercises that get researched more than others. There are some exercise protocols that get researched more than others. There are some people who put exercises together, call it a protocol. Again, it's not a protected term. Anyone can say it. I think I have some exercises online that I've called
come up with my own.
You can make.
I've got a bath time protocol.
You have a bath time protocol. So I think sometimes people, they also get this kind of bias that just because one study found that on like 10 people that this exercise protocol outperformed doing nothing, they're then like, this is the way that we rehab this.
Very black and white.
To be clear, with surgical interventions, that is one of the times where it is actually quite black and white, because we can do studies where we're looking at the similar patients who've had the same surgery, the same injury, and then look at how they progress, and it kind of controls some of those variables.
The variables.
But patients who are hypermobile, they're as variable as they come.
I know.
So it's I tend to look at more what works for the individual patient versus what does a specific protocol say. Again, it's good to look at research, 100%.
It's a good base to start, isn't it?
It's the foundation of clinical decision making. But from there, the best outcomes come down to like, okay, this patient, this doesn't feel quite right. Like I've had patients where I give them an exercise, I think it'll be great for them. And then they're like, Alex, I don't know what's going on, but it just doesn't feel right. And they feel apologetic. And I'm just like, no, like, thank you for telling me that. Let's see if we can find something better. I think last thing I'll say, and then I'll stop talking. I'll talk about you. But it's like, I think people sometimes, they're so okay with accepting mediocrity There's a lot of complacency that comes into this. Yeah.
Yeah. No, go on.
No, people, they don't have this drive to get the best or most optimum clinical outcome possible. And again, it's good.
Oh, you mean the clinicians?
Yeah. I mean the clinicians. Yeah. You told me what you were thinking in a sec, but I mean the clinicians. Yeah. What were you thinking?
No, we've talked about this before. I mean, it's difficult when, particularly in the NHS, like it's been so squeezed and people are just trying to survive in their jobs that they're I mean, and we're the same opinion, like they're just trying to survive.
Yeah, no shade to the
not
NHS.
at all.
I could not deal with like 10 minutes with a patient. Like I could not do my work. I would feel depressed. Like I would be really unhappy.
Yeah, and you get this thing called compassion burnout, and I absolutely understand how it the NHS, unfortunately, at the moment is the perfect breeding ground for compassion burnout, and the patients are the ones that suffer because sometimes, like, you know, I've had a hard time, but I have not had a tenth of the experience of some people that I've talked to. Yeah. So relatively speaking, I've had a good experience-ish. Yeah. But I've had terrible outcomes. Yeah. And the problem with mediocre care is that you finally get the courage up to tackle something that's been bothering you, that you feel insecure about, that is sucking all the joy out of life sometimes. And it could just be, we're just talking about physio here, but same goes for any other kind of health issue. Yeah. But particularly with physio, because it's so physical, that sometimes when you've been out of physical activity and maybe you've put on weight, because guess what? Yeah. Not moving means that it's pretty hard to keep the weight down.
Yeah, or just being in pain.
In pain, not, you know, you can't sleep, you know, blah, blah, blah. You go to the physio and you're like, right, let's do this. Like, let's do it. I'm so up for it. You get there and you get even mediocre is, you know, a bit disappointing. And if it doesn't work, you can't course correct because they say, well, you've had your physio. We've done all we can. You just have to go on painkillers now. Yeah. It's very demotivating, but it also compounds over time, doesn't it? Yeah. When you have less than mediocre experiences with someone who is struggling with compassion, it unfortunately comes out on the patient sometimes, and it's really difficult because you don't know what the parameters are. You don't know what good care looks like compared to mediocre or poor care. I would have no idea. I mean, I maybe would now, but I wouldn't have done before.
Yeah, it's hard when you have to, because if you're someone with chronic illness or disability, you are forced to interact with the healthcare system, but you're not an expert in the healthcare that you're
you can't quality control.
Yeah, 100%.
You can't quality control. You have no idea sometimes.
The patients will tell me things and I'm just like, yeah, that sounds not quite right. based on what I understand. But yeah, no, it's difficult. And then the challenging thing for people who have chronic health issues is they often, you know, I remember the day I put on Instagram, I work with complex chronic treatment resistant injuries. I didn't really know that was code for hypermobile patients, but that's when I just started seeing everyone is hypermobile. But
of course.
When you're dealing with a challenging clinical situation, that person's had neck pain for like 10 years or whatever, you have to treat it like it is something that you care about extremely deeply. Like you have to become so, and again, there's a healthy level of compassion and a healthy level of clinical drive, but you have to be so thoughtful, motivated, precise, technically skilled, you know, able to adapt your care to that patient. If the, you know, especially with my patients, sometimes they have good days, bad days, injuries will happen, subluxation, this and that. And you have to be so on it. And it's not easy, but it's what these patients need. It's what has to happen, because there are patients who, you know, they have, like me in my first experience of manual therapy and exercise, which happened to be with a physio, but I had a negative outcome. I didn't get better. And I was like, wow, this is stupid. The exercises made my symptoms worse. The manual therapy did nothing. The, you know, other treatments they did with like different machines and whatnot did nothing. They've told me it's in my head, there's nothing wrong. So F this, I'm done.
And you assume that they've whipped out every single technique and method they can think of, and that, well, I'm the problem. I'm not treatable.
Absolutely. And she told me, and this is something, again, I'll tell you how I handled it in a sec, but this physio told me that I would have to live with shoulder pain for the rest of my life. And I thought being 16 or 17, this was like the word from like God. I'm like, this person has told me this.
Yes.
This is my fate.
Yeah.
And I didn't realize this was just some physiotherapist in London, Ontario, who maybe wasn't having the best day. Maybe I was frustrating her as a patient. I don't know. But it's like,
Wow.
I didn't know how to interpret that because I thought I was condemned.
There's only one way to interpret it.
Yeah.
She I mean, not to bag on her, but she left no room for any hope at all. And she should be.
We can bag on her a little bit.
It's a very harmful thing to tell a patient.
Yeah.
It's devastating.
Yeah, and I just had this quiet acceptance, and I just got used to living with chronic pain.
Exactly.
It's only through chance that I ended up having another encounter with a manual therapist who helped me with an injury, and I was like, holy cow.
But that could have been lifelong. Literally, her words could have meant you had a lifelong issue.
Oh, I should not be as well as I am today. I should not be working in this field. Like there's, I just would be shocked if 16-year-old, 17-year-old me could see 33-year-old me, they would be like, this is wild. Like this is crazy.
Yeah. And even in your 20s when you struggled with the neck and the migraines.
Yeah, the dark
Can you imagine?
times.
Like if I just wish we could have flashed forward to a period where things did get better. Just so you had that hope.
Oh man, I wish. Yeah. And it's crazy. It's wild how these like early experiences, they really affect how you approach healthcare. So because I'd been told.
Oh, absolutely. It programs you.
Yeah. In this family, we have funny tummies.
Yeah.
As we have to deal with all these things. Your shoulder pain, you'll live with it your whole life. Or your wrist pain, you have to live with it your whole life. When I had those serious headaches, which in hindsight, I've never thought about this before, but I really should have spoken to a doctor about them. I was just like, okay, cool. This is just another way my body's failing me. Oh, well. And because of my mom who died from cancer, I'm like, at least I'm not dying from cancer.
Yeah. But it gives you a completely out of, I can't think of the word.
It negates your whole experience.
You don't have the parameters.
Yeah.
And you think, wow, it's not cancer, so I'm doing really well.
Yeah.
And that's what society tells you as well, actually.
I think people have a hard time accepting like different things are allowed to be difficult in different ways. Luckily I wasn't in like immediate mortal peril from my, really horrible headaches and, trigeminal nerve pain and this and that. But it was a quality of life that I'm scared. Like that's one of my biggest fears of having to experience again, to be honest.
Yeah.
Hannah, we've talked about kind of my weird fitness stuff and anxiety. Can we talk about like bean soup as well to kind of frame the rest of the episode?
Bean soup.
You made me look it up. I have it here.
And it's such a satisfying phrase as well.
I just like it. We're going to make bean soup a thing again. What year was bean soup from?
I think it was this year.
This year, cool. We're bringing the freshest social media updates on here.
No one will believe that we're cosplaying as early 20s on TikTok.
Exactly. I got the baggy jeans and whatever. Okay, bean soup theory describes the what about me effect, where people struggle to understand concepts not directly applicable to them, instead demanding that content be tailored to their specific situation. I think that sounds about right. It's like you said there was this creator who made a bean soup. Yeah. And then people got upset. Like, so what did people say in the comments?
I haven't looked into it fully, but I saw the video and I probably saw a stitch of the video, to tell you the truth. I think I did. And it just spoke to me. Because it was this creator who was like, again, I apologize if this is completely inaccurate, but so I remember. She was like, oh, hey guys, like, this is my bean soup that I take, I think around my period because I struggle with low iron levels and beans have got loads of good iron.
She just likes her beans.
Yeah, she really likes beans.
There we
bean
go.
Soup. This is my recipe, didn't it? Apparently, all of the comments were like, what if you don't like beans?
Yeah, I don't really like beans. I'm going to say.
Some of us can't eat beans. I mean, I'm FODMAP intolerant as a SIBO, so beans, me too. Bad news.
Yeah,
bad news beans.
We're not having beans on the show. But like, people were like, what if you don't like beans, blah, blah, blah.
The one that kind of cracked me up a bit was, what if you don't like beans? What can you substitute it with? Everyone's like, beans. It's bean soup. You can't substitute beans.
Yeah. It's like, and again, it's okay to ask questions. Like, and I'm sure that she probably did a really nice reply and said, like, you can have carrot soup or, I
have no idea.
We'll just say that she did.
But it's the iron in the beans that she was like doing it for. So I don't know. Anyway,
this is difficult. But the thing is, it's hard for every piece of content in every episode of this podcast to reflect every person's experience.
And we can't like caveat every single thing we say because you can't think of every single caveat ever.
No, and then I go hide in a closet and like just never talk ever again.
My brain,
no,
my little pea brain,
we can't do this.
bean brain.
So anyways, if we say something, or if I say something in a later episode of the season that's not for you, it doesn't mean that I don't care about you.
No,
it doesn't mean that we won't talk about things in a future season. I want to have more people on with different health issues. You know, this season has kind of been like, it's not the Alex show as much as the first 2 seasons, but there still is a little bit of me.
Yeah.
And, you know, right now how I manage my health is different, but it's important because there might be some people right now living their best life in the gym who hear my episode and maybe think like, hey, I have some chronic neck pain or some gut issues. I wonder if I could have the same thing as this person talking, you know? So it's like, as much as the chronic illness and disabled community is very important, the people who, you know, we want to keep functioning as well as possible, they're also really important. So everyone's experience is important.
Exactly. And we're just chatting about our own experiences a lot of time anyway.
Yeah.
I mean, there's a lot.
Speaking of chatting about experiences, we spoke before the show about kind of what we talk about the most. And one thing that we talk about a lot is our kind of bodies and how they've affected our access to healthcare or perceptions about healthcare. Can you tell me a little bit about your experience with that?
Yeah, I suppose it's society at a whole, isn't it? How society sees you as a chronically ill person or someone who just struggles physically sometimes. And the medical setting is a reflection of society, isn't it? So there's an awful lot of biases, you know, tens of thousands of biases, but there tends to be some big biases that have worked against me particularly. And because, you know, I do have hEDS and I am hypermobile, there tends to be one picture of somebody who has the issues that I have that has made getting care very difficult. And it's delayed me massively.
Have you had a doctor comment on your height? Because I know you're, how tall are you for viewers? Just
5'2".
5'2". I'm 5'10". The classic like hEDS, HSU, what people think of. And by the way, there is no look. I want to be clear for anyone listening. I have had patients and it breaks my heart, but they think that because they're not white that they can't have this. I know. I was upset by that. But yeah.
Have they been told that?
I don't know.
I'm sure I've heard people saying they were told that.
Well, we've talked about how there aren't many people who are in this space online who are not white, who are creators and influencers in that. And I know those are like awkward words, but there aren't many there's not much non-white representation. And it's huge because then you look and you think it doesn't apply to me because all the people who are talking about it, they don't look like you. And that's a very reasonable thing. So yeah, it's in terms of kind of the classic appearance, it tends to be at least on the social media sphere. And I do think that influences what healthcare providers maybe view things as well. Pale people who are tall and usually kind of like skinny is like the classic look. You'll see people like that. You are 5'1", or 5'2". Sorry, forgive me.
I can't afford to lose an inch.
Can
I interrupt really
You
quickly?
can interrupt me anytime.
Because tragically, a few weeks ago, my mum actually announced that she's lost an inch of height.
Oh, no. I was like worried for a second.
I said, so no wonder I feel like gigantic next to my mum now. But yeah, those dark days will come for me.
They're coming for us all.
And you're 5'10".
Yeah.
You can afford to lose an inch.
It would help you. I need some more space. Our bed is small. I need to shrink a little bit. Otherwise I have to buy a longer bed. But yeah, back to serious stuff. So you're 5'2", and you don't look like the typical HEDS, HSD person that we see. And again, there is no look in case you need to hear it again. So yeah,
but the stereotype online particularly.
Yeah, the online stereotype and what kind of some healthcare providers think of, unfortunately.
Absolutely. I do hit some stereotypes, definitely.
Can you tell me about those?
White.
Yeah.
Like real white.
Yeah. Female. Presenting.
Female, yeah. Yep. White, biologically female.
Yeah.
What else? Young looking-ish.
Yeah. We were talking about that. Young looking.
I am younger looking, so I've been told. Of course, grandma hands.
What is the grandma hands thing? Like, do I have grandma hands?
No, you have a weird...
I have like baby hands.
Yeah, you have, but you have the knuckle indentation things. Apparently the sign of hypermobility.
Well, it makes sense because the joints can go into hyperextension.
You're possibly more hypermobile than mine.
Yeah, I have some hands.
Oh, well, mine goes right back here. I won't do it.
Yeah, we don't do it
That
on
was my
the
party
show.
trick.
Yeah. Can you do the thumb touching thing?
I used to be able to.
Yeah, they stiffen up. Mine are stiffening as well. Don't.
No, I'm not going to do it to
Okay,
hurt. Don't worry.
sacrifice yourself.
Stand down.
We take
But
safety seriously here.
like there,
Yeah.
but I used to be able to touch.
Yeah.
But with effort.
And they stiffen up a lot in your 30s.
And this, that goes to there. That just about hurts there. But it used to go back to
all
here.
the way back. Yeah. It's well, but going back to kind of, so you fit some stereotypes.
White,
basically.
female, I don't know. There's probably a couple others I've forgotten, but but as we've talked about before, I always knew that I was muscly. Like I'm from, a fairly muscly family, but on both sides. I mean, my mum's not overly muscly, but...
Can I contextualize a little bit? Your family's all like quite compact in build and sturdy. Like even, like your dad, for example, he's relatively like, given his age, he's like a relatively physically capable person. Is that okay to say?
Yeah.
He's like, he's like a strong looking guy, but he's just he's not lanky.
He's 5'10".
Is he?
Yeah, and I think
Really?
that, I mean, again, he's probably shrunk. Sorry, Dad. But he used to be 5'10", and well, he was a rugby player, typical rugby player.
Yeah, there we go.
physique.
Yeah,
Not a beefed up rugby player, but
just compact and sturdy.
Yeah, very sturdy. I mean, yeah, like I could laugh. My uncle on my mum's side would he would always comment on my dad's forearms if they're in the pub or something. He'd be like, "You got to calm down, Pete. You got to not. You see, you're holding all your tension in your muscles." And he's like, I am calm.
Yeah.
I'm sat in the pub I'm like 2 pints down. I'm like as happy as Larry. And he's like, no, you're holding all your tension in your muscles. And obviously we know now that we're just solid muscle.
You're just muscular. And we can kind of see that presentation in you. So like as someone who knows you, again, you are not my patient. You've never been my patient, but just as like a friend, you're like, oh, Alex, like how do my forearms feel? Yeah, some people have a more pronounced muscle tone or bulk than others. And you have like relatively, given your level of physical activity, because you're not able to exercise really at all because of your health issues, which again is fine. That's what you need to do for you. But like you have more muscle mass than we would expect to see in someone who is as sedentary as you are right now.
Yeah. No, I didn't realize. I had no idea. I thought that people were born with muscle that kind of just stayed. I just didn't realize.
There's so many listeners who are going to be jealous of this again. Everyone's experience is different. But yeah, you just retain muscle mass well.
I had no idea. And that masked the joint instability massively. So I genuinely think that if I wasn't a genetic mutant on multiple levels,
anyways,
I probably would have figured out there's something not quite right, because of course the joint I was going to say dysregulation, that's not the right word.
Instability
and the subluxations and dislocations and things are one of the more stereotypical like red flags of there's something going on a little bit. I didn't necessarily have that, and I didn't realize the subluxing as well. Had no idea. But again, because you don't know what it's like to be in somebody else's body. You know some bigger things, but all of the different like language of your body, different pains and different subluxations, different sensations. I kind of saw them as like different flavors. I didn't really realize it was pain.
Yeah, go on.
I didn't really realize that like it was necessarily bad or that it was unusual. And then I had a sort of a realization probably about 4 years ago, and I realized, oh, this is pain. It's not just my muscle feeling not happy. It's not just, oh, I'm uncomfortable. I think I always think of being uncomfortable. This part's uncomfortable. This part's uncomfortable. When we talk about moderate pain, I never thought of it as pain. So sometimes when you don't realize that you are a chronic pain sufferer, there's other things where you miss yourself off the kind of what it looks like to have hypermobility and hEDS. So if I'd have known that I was in pain, if I'd have known that I was subluxing, that could have been 2 more things on the list of that actually looks like hEDS, but sometimes you don't realize.
Do you ever think back to when you were younger too? Because I think of this and it's wild that even in my early 20s, when I had some of that stuff, like the headaches I had going on, the neck pain and so on, if someone gave me a medical form and said, tick the box if you experience chronic pain like every day, I would have been like, no, I'm cool.
I know.
And that's unbelievable because I would have then gone home to be in agony, cancel all my plans and lie in a dark room waiting for my pain to end. But like, it's really hard to accept, I think, in a lot of ways that pain is like a chronic, a constant thing that you've had to deal with. And I know it was really hard for me. And the whole question, I talked about this with another guest, but have you ever experienced like a true zero? That question haunts me.
Yes.
Like,
it's like finding out no pain is normal. I was like, what?
I know. I've talked about my brother before, but I'm just like shocked by people.
I know.
Who,
Some
like,
blessed people.
I don't understand how you just like cannot have had pain of a disabling intensity in childhood. And even if you wouldn't accept it as pain, as you and I both didn't, I was just told, oh, that's normal. It's really weird, that other existence. Going back to body image, something that we have in common is actually PCOS. And I haven't talked about this as much as I should. And to be clear, I have not been officially medically diagnosed with PCOS. We'll talk about this in a second. But Hannah, how did your body presentation affect your diagnostic journey of PCOS?
Well, I walked in the door and you went, you look like you got PCOS. And I was like, oh, great. No, I said in the last episode that, you know, chat. And then he said, well, you do have a very PCOS figure. And I was like, okay, fine. But I, of course, if you are overweight, you know, I'm more overweight than I was back then for sure. You get a foot in the door. And actually, I was listening to Laura Bryden's podcast this morning. Whilst I was trying to sleep. But it's the wrong podcast to pick. Because it's very, very interesting.
Not too intellectual. I'm joking. No, Laura Bryden.
No, I hadn't listened to her podcast before, so I didn't know.
I don't think I've heard it. I've only read her books. Just for listeners, she is a naturopath. I know she's she's someone who, like me, like I'm an osteopath, but she works in a very medically aligned or scientifically aligned way. And she works with patients who have various types of female-specific health issues and has written some brilliant books, The Period Repair Manual, The Hormone Repair Manual. I really rate her content. She has some blog posts where she talks about estrogen and diamine oxidase and histamine even. But before I interrupt further, you were listening to her podcast.
Yeah.
What happened?
And she was saying about how to actually diagnose PCOS.
Oh,
and
what did she say?
So, again, I apologise if I've got this. I might have this completely wrong.
This is not medical advice.
Not medical advice. I also have a very bad memory. But she was saying that you can't. So I think I don't have the testosterone dominant PCOS. I have a very strong estrogen dominance, which, you know, makes sense with the picture of the histamine and all that malarkey. But I have had a ultrasound confirming, you know, cysts in the ovaries, but you're polycystic. But from what I've learnt, you can't actually confirm PCOS through just an ultrasound. So I always understood.
No, you absolutely cannot. For anyone listening, the ultrasound is actually borderline useless.
Yes.
And I'm very careful in what I will say firmly and what I will not say. Again, I'm not a medical doctor. I'm certainly not a gynecological specialist. But female-specific health and ovary and uterus-related health is very much a secondary interest of mine because of what I've been through. And an ultrasound is not sufficient to diagnose in any way. It
was presented to me. Again, I might have misunderstood, but it very much was. No, I mean, when it happened, I don't know, many moons ago, 15, 20 years ago, something ridiculous. No, probably 15 years ago. It was very much presented to me that I had a PCOS diagnosis already without an ultrasound, which is a little bit strange. But I then had further issues where my period stopped entirely for like 5 years, I would say. And obviously the investigations stopped because it was like, well, go on hormonal birth control. I was like, no.
Because they tried to say it would bring your period back. That's nonsense.
Yeah, fortunately, I knew enough about that. I just thought that's nuts.
And to be clear, we're not anti-hormonal birth control here. I'm just pro it for the right patients in the right situations. And it's not going to restore your normal hormonal ovulatory cycles.
It suppresses
them. Yeah.
And
again, sometimes that's the right clinical decision. There are patients where it is a life-saving, like important medication. I'm pro the more medications, the more options we have, the better. But yeah, when they tell people, oh, it'll bring back your cycle,
it's been the I mean, it's just outright lying. Sometimes it is full on lying. Yeah, exactly. I'm exactly the same. Every treatment has its pros and cons, and every treatment has its appropriate treatment setting.
And the more options, the better.
Exactly.
Everyone with chronic illness, we need to be all like pro more options. You know, they may not be right for you, but they could be right for someone else.
And that's why, I mean, not to segue,
tangent, go for it,
whatever.
Run.
I'm going off the track. That's why I'm a huge fan of naturopathic and functional medicine options, because I want as many options as possible. I don't just want pharmaceutical options. I would like some herbal options when maybe the pharmaceutical options I'm allergic to, or it interferes with another medication. I'm pro having as many safe options as possible.
And I have to bring up too, brilliantly, like, you're working with someone who is co-qualified as a medical doctor and a naturopath. So again, it's like any industry. You have to be careful and you have to be safe. And I don't want anyone in the comments saying that I'm like promoting that they use medical herbalism instead of medication. I'm not doing that. It's actually not my place. One of the best things about not being a medical doctor is I can't really have opinions on these things that strongly.
I can have all my opinions and be completely wrong. No, I'm joking.
Exactly. This is the Alex show. I'm joking. Although my company and I do fund this show. This is all funded by me. So if anyone would like to ever sponsor this show, please let me know. Please reach out. We would we'll do a season 4 regardless. I'll just have to,
we need a hypermobility HQ, an Alex podcast that tours the globe, and then I can join. So we need sponsorship.
We do. We'll take it to the next level. But going back to your experience, so you have naturopath and MD co-qualified. You're careful in who you work with. And and you're not going to be like, hi, cardiologist, you've told me this medication is important for me, but lols, I'm going to go like take some random medical herbalism instead. Like, you do safe and sensible decision making.
Exactly. Like, I don't play about you know, that type of thing. Like, it's very, as I say, I like all of my options. I like smart people. It doesn't matter what they do in my life. My doctors need to be smart. My friends need to be smart. But as I say, I like all my options. But going back to the PCOS, they told me that that I had PCOS, but my period stopped, and I thought, that sounds very, very not PCOS-ish, but I'm sure it can happen with PCOS at that time.
It's amenorrhea technically of some type, but they need to diagnose it. Is it primary? Is it secondary? They have to figure, like, this is what I don't like.
What's the cause?
Yeah, and again, I don't like that I have to criticize people for this stuff because I'm not a medical doctor, but you can't just have a patient who has PCOS, then her periods just stop, and then be like, okay, cool story, bro. Like, you can't do that. You have to figure out what is causing this cessation, because there can be sometimes serious reasons why things happen.
But there probably was, though, Alex. I think this is when my adrenal possibly the kind of hyperpots was off the scale. I think that's what ruined a lot of my hormonal resiliency, and I think that I was in some sort of adrenal crisis for sure. Again, I don't really know what I'm talking about, but this is what I've picked up.
It's your experience.
It does fit the picture. I think when I'm trying to figure out a picture of what was happening and what's happening now, it absolutely fits the picture. So something should have been investigated for sure. And I was not backwards and coming forwards about going to the doctors and say, hey, I'm really struggling with this still. But yeah, it was the Mirena, it was hormonal birth control. And then I lost steam with everything. I thought, well, my periods aren't happening, but maybe they'll come back. I can't keep doing this, because I was getting the same advice of go to the gym and lose weight and everything will get better. Go to the gym, lose weight. I'm like, okay. So I did, and they still didn't come back. So yeah, it was when we talk about bias in the medical field and how my experience has been changed, for sure, fat phobia plays a massive part. I haven't suffered with it as intensely as some people have. I've only ever had one, maybe two doctors who have directly said it, and I've thought, there's something that's a very much a brush off. They used it to brush me off.
Yeah.
But I can't say what part that didn't play in other clinical decision making.
Yeah.
So with the PCOS, I could absolutely see that being, well, she's been told to lose weight. That's what she needs to do. That's what will fix it all.
Yeah.
And it's very, it takes away your confidence.
And it even though it kind of helped you get the diagnosis, it kind of also helped them wash their hands of you, because they've now told you, yeah, you have PCOS because of your weight.
Exactly.
You sort this out, it's on you. And it
Exactly.
it lets them absolve their responsibility or their role as the healthcare provider in that situation.
Absolutely. And I'm very honest with my doctors. I never, what's the point? You've got to go to be honest because you want to work it out. And I started my periods when I was 11. And they were never regular, right from the beginning. They were every other month. They were never like clockwork. So that was pre-weight gain.
And that can be normal, to be clear, when someone's going through puberty. Like when I started to learn about female specific health and, cycle specific health, your brain has to talk to your ovaries, has to talk to your adrenal glands. You have the hypothalamic pituitary adrenal ovarian axis and all of this stuff. HPA. Oh, don't forget the O. But everything has to talk to everything. And it's hard. And the tissues that produce those hormones, they have to get better at producing them. The receptors have to get better at receiving them. And this is the extent of my knowledge about hormones, but it's complex systems, and it does take a while often for hormonal cycles to become established. I think that Laura Bryan actually in the Period Repair Manual maybe talks about this. There's a couple other books I like, and I encourage you always, if you're listening to this or watching it, do your own research. But that type of normality, I believe it can take years, maybe even slightly longer to get established. I know I had a similar experience. What I can say is when it comes to when I have young female patients like you in your early 20s, and you are, you're not having periods and you're not on anything that would be suppressing that.
Exactly.
That's a serious concern. And one reason why it becomes a serious concern is because of bone density. So people who have, estrogen dominant hormonal profiles, people who are females, they struggle, or sorry, they will hopefully not struggle, but they will reach their peak bone density at around their late 20s. Maybe early 30s. And again, I'm not an expert here, but that's kind of when you're going to reach that peak bone density. You then will kind of plateau in that bone density. And then when you go through menopause, it will start to decrease over time. We want that person's bone density to get as high as it can, so you have further to fall. It's like a managed decline, basically. Although I don't think of aging as a decline, but a hormonal decline, bone density decline it is.
Well, your favourite phrase, make hay whilst the sun shines.
Yeah, you want to make hay whilst the sun shines, absolutely. And one thing that you can do in your 20s, basically, to try and achieve that is to, in addition to doing ideally some strength training, if it's possible and safe for that person to do it, you want to be having ideally healthy hormonal cycles. That's one way to build up this kind of health buffer. And when you have chronic health issues and that starts to erode that ability for your body to do that, it can have lasting consequences. Like I get worried about bone density issues in all my patients, quite to be honest.
I've never once was that mentioned. Never.
And that's kind of the role I play. So hopefully this will help anyone listening. So I obviously treat muscle and joint pain and I manage that and I do rehabilitative exercises and all of that, right? But one thing I try to do, and the reason that I do a pretty thorough medical history at the first appointment at least, and I try to stay updated on changes in medical history, is because sometimes things happen and I'm like, that's not right. I don't know what the solution is, but I know that's not right. And you need to ask your medical doctor to explain how we're going to manage this aspect of your health. So that's kind of the role I end up playing, just as an aside. In terms of with PCOS, I'll share my story for a sec. So I had kind of the opposite experience to you in that I was in my again same age, early 20s, had a history of irregular cycles, lots of pain. I was
19 actually. Now I think about it.
I would have been 21, 22 because it was in the UK, maybe slightly older, but I had a lot of pain, a lot of period pain, really irregular cycles.
Did you have pain outside of your period as well?
Yeah. And my muscle and joint pain was at its worst as well, even though I would have been like, I'm fine. Like I'm early 20s. How can I have any health issues going on? But I went to my medical doctor, my GP, and I had looked up the diagnostic criteria for PCOS. I'm very...
True Alex fashion.
Printed it off. I love a printout.
So theatrical.
You can show people things on your phone, but it's not the same as a printout. No. There's something tangible about that piece of paper.
It's the drop.
Exactly. So I brought it in.
No, but it does.
Yeah. And I was like, hi, I have these symptoms. I think I might have PCOS. Can we investigate me for them? So we did. I had some blood tests, which did show elevated levels of certain hormones which are associated with PCOS. In my case, it wasn't so much, again, people talk about testing testosterone. There are many different types and versions of testosterone. And I only had one that was slightly elevated, but it was elevated. It was just at the lowest end of what's considered to be high.
Yeah.
I had issues with sex hormone binding globulin and I believe luteinizing hormone. Again, I have the blood test results somewhere. That's based off my memory. I had documented long and ovulatory cycles.
Yeah.
So this is when I got into charting my cycle. So actually I would have been around 25 when this happened, not early 20s, somewhere mid 20s. But I had detailed charts showing my my basal body temperature, my cervical fluid or cervical mucus observations. Like I was like,
You were like, not argue with me.
I'm like, I'm not ovulating, basically. Like here is the, you know, and here's the research about why this method of tracking is accurate for identifying whether or not you're ovulating. And to be clear, I'm not here promoting that anyone use that as birth control. These are discussions for other people and other podcasts and other experts. But what I can say is that if you're trying to figure out for your health reasons, am I ovulating or not?
It's just data. It's good data.
Yeah, learning how to chart your cycle using, I use the Sensi Plan protocol. That was what I did at the time.
Yeah.
And again, I will say this one more time. I'm not telling you to do this. This is what I was doing, okay? So anyways, I did all that, went to my doctor, and I was like, I'm not ovulating. I'm going like 3 months plus, you know?
Yeah.
My longest cycle was 180 something days, and I have the chart saved on my phone just to remind myself that I wasn't well sometimes.
So what is the ideal?
The a normal cycle. So a cycle is considered long if it's longer than 35 days and short if it's less than, I think it's 24.
So 180 is just...
Yeah. That was, I felt like trash the whole time, by the way. Headaches, muscle and joint pain, fatigue. I was gaining weight. So the weird thing is I was eventually told that I couldn't possibly have PCOS because I was too skinny.
Yeah.
And that's what this GP told me. I also had no cysts on the ultrasound as well. So again, she's like, yeah, you don't have cysts and you're not overweight, so you can't have PCOS, which makes no sense because as per the diagnostic criteria back then, and I'm not sure what they are now.
It's still not on.
Yeah, you had to have 2 of 3 things. It was long and ovulatory cycle, elevated hormones associated with PCOS, and or cysts on the ovaries. You had to have 2 of 3. So if you have 2, the ultrasound becomes irrelevant, basically. And as far as I know, cysts can be a normal finding on an ultrasound.
Yeah.
Everyone will, I think it's once a year, even someone with healthy cycles will have like a few cysts appear. It's just a thing that happens.
So according to my podcast, when I was translating, she said that that it's a really normal thing and it's just a sign that you haven't ovulated properly.
Yeah.
And you can not ovulate properly for loads of different reasons. It's normal.
Yeah.
Like maybe you didn't eat enough, maybe you're very stressed, too much exercise.
And it's not normal if it's all the time. And for years and years, there's a point where it's not normal.
But that's the point. So if, I got scanned and they were like, oh, yeah, lots of cysts. Yeah. I mean, obviously in my case, like I really wasn't ovulating, but for somebody else, they were right positive tests, but it's just that month they
depends where they catch you.
They got back to normal,
Exactly. It's the ups and the downs. It's a fluctuating type of situation.
It's the trend.
So in my case, I was then also told, oh, well, you can go on hormonal birth control. And I said, look, I can't. I was on it for like 9 years or 8 years or something previous because I had some, acne issues in my teens. It was a really common thing at the time. There are some, again, they're very minor. And the last thing I want to do is make anyone not feel comfortable with the type of birth control they're using. So it's important that if someone listening has a system that works for them, you do that.
Absolutely.
But in my case, I looked at some of the potential risks or concerns about things like breast cancer and stroke. I have a family history of some things in that area. And obviously, even though the risks still would have been very, very low, I didn't feel comfortable with them.
And that's informed consent.
Yeah.
You were able to weigh it up and go, I'll go for it all. I'll find something else.
And it's like a major theme of this podcast. And I hope everything that I do is there are no options that are risk-free.
Yeah.
I spoke with my coach on the episode I recorded with him, like not exercising has risks. Exercising also has risks. Everything, different types of exercise have risks in different ways. Like everything is a big risk sandwich in life. You have to pick which type and amount of risk you feel best dealing with.
I mean, we talked about it last time, constant calculating is exhausting.
Yeah.
And, I said to my parents, like, well, because I struggle with histamine issues, like, well, and FODMAP issues and sulfur issues, do you want to eat this or this? And I'm like, calculating. I'm like, okay, because I had eggs for breakfast, I had chicken for that, that's too much sulfur. Like everything is pick your poison or risk sandwich, but I think yours is more palatable.
Well, 100%. It's like there's often no good option. Ultimately.
Yeah, you just got to go with the best risk sandwich that you can put together.
Yeah, I'm a fan of trial and error too.
Yeah,
so
massively.
What I ended up doing, what helped me, because the whole PCOS thing, it's really the kind of the start of my journey with all this.
Yeah, big realizations, really.
And it was the thing that gave me hope. Was I literally left that doctor's office. I was like, well, guess I'm on my own now.
But that's the feeling you get. You literally feel on your own. By the way, if you see me rolling this up,
do you want my pillow?
No, this is not just for fashion. I have a grumpy shoulder.
Oh, take my pillow.
No, it's fine. I have short arms.
Well, that's true. You're doing position of true rest or supported rest. You're propping your joints up, because if they're not propped up, then they're obviously having to support themselves, and that could be irritating, as I am with my little it's better late than single style pillow. That show. Do you not see that? Yeah, they always have the pillow on the lap.
It's for modesty, Alex.
Maybe they're all hypermobile.
No, some of them. You and I watch it, and I like, because I'm learning from you. I'm getting better. I'm like, oh, that's a hypermobile knee.
Yep. We'll get to tea in a second, because there's stuff we have to touch on. But just wrapping up the whole PCOS thing.
Yeah.
That was, and this is the first
big realizations.
This is the thing that kickstarted my whole progress, because you asked me at the end of last episode, you're like, how did you get to where you are today? And honestly, it was when that doctor's door shut, and she's like, yeah, good luck. I have nothing else to help you with. Peace out. And I was like,
I think I went through a similar thing. At some point, I must have just realized I'm on my own. Because I remember saying to you that it was very much a feeling like you're on your own, and that they're not going to be thinking about you when they're going home. You're like, I think about my patients when I go home, and I believe you. But
unfortunately, I'm trying to get better.
It's kind of that feeling of being on your own and going, I'm going to have to do this myself.
Yeah.
But go on, sorry.
Yeah, with no support at all.
Yeah.
Like, she was like, you're done. So I just left, and I did a lot of research, and obviously the medication option, and again, hormonal birth control does not treat PCOS. It can suppress cycles, and sometimes that's good. Sometimes people need a break.
Yeah.
My cycles, I had less pain, to be honest, when I was on the hormonal birth control than when I was off it. So again, there's pros and cons each way,
that's
right?
a good point. And sometimes you have to go to the fallback position to make progress. So if you're really struggling with, particularly with hypermobile people, you've got so much going on. You just need some mental and physical space from symptoms to sort something else out.
People need a break. It's exhausting living with the burden of having chronic health conditions. And sometimes I see patients where they're nervous to speak with their medical doctor about pain management because they don't want to take like drugs. And I just look at them and I'm like, you are tired. Yes. You have dealt with this for so long. Yeah. You need a break.
Your soul is tired.
Yeah. And I'm like, look, there are certainly risks with different pain medications. People get worried about, like addiction and side effects, which are totally reasonable concerns.
Absolutely, yeah.
But I'm like, this is why we have these medications, is so that you can talk with people who are appropriately qualified to discuss them with you, which is not me, but you can talk with your medical doctors, and they might be able to support you in a short-term intervention just to try and get you some sleep if you're in so much pain you can't sleep at night or whatever. Sometimes you need that way to have a break from the pain. But in my case, I didn't have any support there. I remember going to a pharmacist one day. She gave me some special painkillers that are available from a pharmacy in the UK, because it was actually my boyfriend who went at the time, but I was in agony. There was one day I'll never forget. I was like lying on the bathroom floor. I couldn't reach my phone. He wasn't home, and I was just like, I guess this is the end. Yeah. I don't know what it was, but it was such a high pain level. Sorry, go on.
But no, I'm interrupting you. Don't worry.
It's good. It's a nice change.
I know we're both terrible. We've been very well behaved today. But also, it's crucial to remember that you don't know that pain's going to end. I mean, I had one of the most absolutely horrific periods about 6 months ago, and I was literally considering going to A&E. It was that bad. I couldn't breathe. And I was pretty sure that was going to end, but for many other pain, your shoulder pain, you were told it was never going to end.
Yeah.
You don't know it's not going to, you don't know that it will end.
And you don't know, like, do you have red flag symptoms? Like, you're not medically trained.
Exactly.
You're not even trained to my level. So you don't know how, you don't have skills to triage, basically.
No,
I can kind of do like, am I in mortal peril badly or not? But I don't know how patients cope if they don't have a strong healthcare background.
Yeah.
With the PCOS, so I had these, it wasn't an easy journey. It took me about 2 years. What I did was kind of similar to you. I was like, look, medication in my case isn't really working. What can I do? I did a bunch of research. I ended up taking, not all together. Please do your research. Please talk with your medical doctors. Please do that.
It's so intricate. You got to be.
Yeah. I took a myo-inositol. They do like a 40-to-1 with D-chiroinositol. So I took that, and the research is really good.
Yes. Can I tell you?
Yes.
No, you've just said exactly what I was going to intro with. That if you take too much of a certain type of myo-inositol, it changes to the one that actually makes PCOS worse.
Yeah.
And you have to get the not the ratio. God, what's
the dose, correct?
Yes.
Yeah.
You said 40-to-1. That's what you need.
The
Essentially,
ratio,
that's what you said. The ratio, that's the word.
Inositols are really interesting molecules. They're in different tissues in different ratios in different ways. People, like people who have testosterone dominant hormonal profiles, or people who are like males, they have different ratios in different ways than females.
Yeah.
So inositols are just really cool. Everyone should learn more about them.
So you took myo-inositol.
I took myo-inositol, like a 40-to-1 ratio with D-chironositol. Yeah. At some point, I also trialed berberine, and I don't think I took them together because they have similar mechanisms of action. So this is where detailed research becomes critical. And I am going to give a shout out to examine.com. You've heard me talk about them many times. I am examine.com's #1 fan. Yeah. It is a website where they synthesize research. So even for me, reading a piece of primary research on PubMed is difficult. It's tiring. It's exhausting. It's not fun. I don't enjoy it. But that's why I'm not a researcher, let's be honest. But if you use examine.com, what's really helpful is that they synthesize the research. So you could go home, you could type in myo-inositol, and what will come up is links to a bunch of studies and kind of some tables just summarizing the findings of those studies. Yeah, so what dosages were used in different studies? What does it interact with? Because people forget supplements have interactions.
Just because it's natural medicine or a supplement doesn't mean if something never interacts with anything and there are no side effects or risks, it means it doesn't work.
Yeah.
Well, there's very little.
There'll be something in there. Look, I'm not experts in pharmaceuticals. We're not experts in supplements necessarily, but people need to, if you're taking a supplement for a specific reason, it has a mechanism of action. It's going to do things in your body. So you need to be careful. Yeah. You have to take it seriously. And if you're someone who is kind of like on your own trying to navigate that, examine.com is a tool that I think people can use to try and be safe. But I was on examine.com in the early days, looking up everything, looking up studies, getting the protocols used in studies, making my own little like strategies.
How did you implement it then? So when you did your little research, did you make notes? How did you?
Yeah. Oh, I had like notes and notes and notes. And
this is what I'm going to trial this month.
Yeah. Well, and I would do it for 3 months at a time. I picked that as my intervention window, basically.
Sounds right.
So I had my methodology for my own personal health exploration, basically. But out of desperation, I was just like trying various things. So I would try a supplement for 3 months. I would then try another. I was trying to not mix too many things because I wanted to see what had an effect and what didn't. Yeah. I tried not exercising. I tried exercising. I tried different types of exercising. Like I was just trying a bunch of different things in different ways. Long story short, eventually things did start to improve. I do have to add in the anecdote. I was so desperate. I have a bit of a phobia of needles. If you want dry needling, do not see me. I do not do that. I will pass out. But I made up that I had like an aunt. I went to Boots and I wanted to buy a blood glucose monitor because I was convinced PCOS should really be reclassified as female metabolic syndrome or cycle-related metabolic syndrome or whatever. So basically, I was convinced that there was something wrong with my, metabolism. So, my insulin response. So I went to Boots and I was like, hi, I have an aunt who's a diabetic and she forgot her blood glucose monitor. Can you sell me one? And they were like, this is a very weird 24-year-old.
Did you not think that they would sell it to you? You're not allowed to buy this.
I think you're supposed to have diabetes to buy these things. Like I was just basically making up that I wanted to have them because I wanted to know what was going on with my blood glucose. Anyways, I remember I would sit on the kitchen floor trying to like stab my finger. It's hard to do. There is a technique, and it's harder to do if you are going to pass out and have a needle phobia.
Oh, I forgot, yeah.
That's how desperate I was.
Yeah.
Anyways, I was trying to do all these objective assessments. I eventually got to a point where things did improve. I now have regular, knock on wood, cycles, which is wild. I've been that way for years. And for me, that was the first thing. It did two things. One, it took away this hormonal chaos element that I've had to deal with, as you know what it's like.
Stabilized it a bit.
And two, it gave me hope and taught me that I can maybe change things. Even when people say it's not possible, maybe I can improve things. And again, I'm not saying that like it's like I have a cure. I wasn't even diagnosed with PCOS. So this is just my own weird health experience.
So this was before you went to the doctors and you were like...
No, after. This was after.
Oh, so she didn't even diagnose?
No, I was told I was too skinny.
Oh, I thought you argued your way in.
No.
No,
I'm
so
not
she
that
still
fierce.
didn't...
No, she didn't get diagnosed.
That's shocking.
But I definitely, like, as far as I'm aware, I met the diagnostic criteria at the time.
That I find that really... Yeah.
Yeah, she was just like, peace out, have a nice life.
She should have... I mean, not someone how to do the job, but really, that should have been referred. If she was like, this doesn't match up the criteria and I'm not too sure here, I'll refer.
Yeah, that would have been the smart, because I was missing classes. I couldn't work. Like, it was affecting my life as well. But touching real quick on other things in life, because I know we're running out of time, and you're leaving, you're moving to New Zealand, which I'm really cross about, quite frankly.
I know.
But can we talk real quick about Housewives and
of course
Meredith Marks and the bath?
You can leave.
I am disengaging. No, I got into Housewives partly because of you, partly because of Dave. And I have to say, the whole bath thing, you know, when Meredith is like, for listeners who don't know what we're talking about, this is Real Housewives of Salt Lake City. It is where I love spending time with these women. I do think it's hard to put your life out there. I do actually like respect them more. You know, people think it's like a trashy show, and I'm not saying it's like going to get an Oscar, but for me, it's been a really interesting show to, you know, kind of engage with over time. And you know, when Meredith goes to the hotel in Salt Lake City and she's really upset 'cause she doesn't get a bath, I'd be upset too.
I did think, you know, I was like, interesting.
Maybe.
Because I would be upset.
Yeah, what if you have a bad pain day and you need a bath?
I need to mermaid ASAP.
Yeah, like if I had a bath in my room and you didn't, I would give you my room. I would just ask that if I did have a bad pain day that you'd let me have a bath.
Exactly.
But I would feel like your need might be greater than mine right now, for sure.
I don't know. Who knows what pain days are.
Yeah, how do we quantify things?
Exactly.
Numbers are tricky. Hannah, it has been an absolute delight to have you on today, and I don't want to let you go because you're gonna leave me.
I know.
When it comes to, let's talk about friendship and hypermobility, is there any advice that you would kind of give, you know, yourself, or maybe previously, or maybe you're one of those people who's always had lots of friends? I don't know, I've struggled.
No.
Is there any
I've been a solitary animal for a long time.
Well, and then the hypermobility connected us.
I know, no, it literally did.
Is there any advice you'd like to give listeners, or
in terms of how to make friends, or
I don't know, how to just, I think for me, what I would have told myself is, look, like, you're struggling partly with friendships because you have chronic health issues, and the people who get it, the people who don't, and
it's very difficult. I mean, at the moment it's very much a feeling of you don't really belong anywhere, because I can't really fit into society in a lot of places where I would get social interaction, like, you know, working in an office setting, for example, having workmates, that people don't appreciate just how much social, I know from a social battery perspective, people often understand that.
Yeah, and you can, like, right now go to the gym or make friends at like a spin class. So you're your world becomes a bit small.
It shrinks, and it's very difficult to kind of maintain a sense of self and to keep yourself ticking over, because I'm an introvert and I need to be in people-y settings to keep me ticking over, otherwise I get nervous and I just shrink up. But that's when I think if you've had a bit of a hard time keeping friendships going for whatever reason, chronic illness, like, you know, to an extent where it's disabling and it stops you doing everyday activities where you would meet people naturally. I forgot what I was saying.
I think just being aware that, like, it happens. It's a
Sorry, I remembered. I've come back online. I've come back online. it also means that I think that I can spot somebody who I think is a really good person straight away, I think. So that's why when I saw you on TikTok, I thought, I like her. So, yeah, I think that it, as much as things get a little bit isolating, I do think it makes you better at spotting people who are like quality human beings, definitely. Yeah, definitely, because I think a lot of people waste some time with people who maybe aren't good for them. And when you have chronic illness where you are trying to survive, like, you haven't got time for people who bring kind of take money out of the pot.
You don't have the energy for that.
Yeah, you literally just don't have time. So I think it makes you more selective. But yeah, I think social media, as much as it's a bit toxic sometimes, for sure, it's also an opportunity for kind of making friends and lasting relationships like us.
One day we still do our ultimate girls trip before you go away. Ultimate girls trip Yorkshire.
Before we go, I do want to see what my
shoot, I forgot.
Because you promised me. I've held off.
And I brought it. I actually remembered, which is shocking. But so this is a grip strength testing device. A dynamometer, I believe, is the technical term for it.
I've been dying for this.
Hannah is surprisingly strong. And again, don't do this at home. If your fingers are going to dislocate, you're going to injure yourself. Please, kids, be safe, or adults. Hopefully adults listening to this episode.
So excited.
But yeah, this just shows people's grip strength, and we'll see how I do today. We'll see. Okay. Oh my God, it wasn't on. Okay, we're going to go again. 34.4.
Oh, that's
not bad.
good.
I'm in the top 20. Again, I looked at some study. Different studies calibrate this different ways. This is like an Amazon's finest option. This is not a clinically
my hands are
calibrated.
sweaty. I'm actually nervous.
I know my hands are slightly sweaty too. So I got 34.4. You can try now. Let's see who wins.
I'm intimidated
no pressure,
now.
Hannah.
Now seeing how hard you had to do it.
I did cramp my armpit.
Oh, so you just literally go for it.
It was worth it. The number, yeah.
Oh no, that's
go
hard.
Harder. Okay, let's see. What'd I get?
39.8.
Give me this.
I want you go again, and then I'll go.
I'm not going again. No, you're done.
No, let me do it again.
Okay, well, I'm not going again because I'm going to hurt myself. You go one more time if you want. I'm going to talk while you do that. Okay, so you do that and tell me the number. But basically, long story short, my Hannah and I have talked about kind of her figure, and it's funny because
topped out.
Hannah was, I swear, like meant to do strong woman activities in another life because you just have a shockingly strong grip and a ability to maintain muscle mass. And I hope that one day when you're some of your health issues are hopefully have you in a little bit better place, that maybe you'll be able to head to do some strength training because you have some natural talent right here.
That was hard.
Anyways, Hannah, thank you so much for being on here today.
Thank you for
I would
having
keep
me.
you longer if I could. We have to set our wonderful Brian free. He has a life to live.
Set him free.
We need to wrap up here. So anyways, thank you to everyone who's listened today. Please be careful if you get one of these and try this at home. And I can't wait to share this season with you. I hope you enjoy it as much as I have making it. Take care. Bye.